This is Dr. Michael Allon. I'm interviewing one of our dialysis patients, Larry Henderson, regarding his experience with being a dialysis patient dealing with the COVID-19 epidemic. Good morning, Mr. Henderson.
Good morning, Dr. Allon.
How long have you been treated with dialysis?
I would say 11 plus years.
That's a long time.
It is, yeah.
What changes have you experienced with your dialysis since we started the COVID epidemic?
Well, I've just been washing my hands more and wiping down my apartment more. And, just trying to stay isolated.
Can you describe the changes that you've seen in the dialysis unit since the COVID pandemic?
Yes. They've been checking my temperature before I come in and giving me a mask and giving me hand sanitizer. Everybody's just aware, of the times we're living in.
Do they ask you any specific questions when you come to dialysis?
Well, they asked me if I had any cough or fever or any other problems besides dialysis.
Okay, thank you. So what concerns do you have about coming to dialysis during the COVID pandemic?
Well, just the fact of sitting near people or walking by people and everything, just trying to stay isolated to myself.
Okay. And I understand that you recently had symptoms that were suspicious for COVID, is that right?
That's correct. Yeah, I came in, must have been last Friday, and she checked my temperature, and it was elevated somewhat, not necessarily a whole lot of what I would consider a whole lot, but it frightened the chick, and it frightened me also. And I ended up having to dialyze the next day at another center where I could go on and be tested after my dialyzing. I was tested over at UAB at 11 o'clock, and thankfully the results were negative.
What was it like having to dialyze in a special unit for patients with COVID?
Well, I had heard of Central at UAB, and I was just concerned and trying to get well, regardless of where it was.
What do you think that the kidney doctors and the dialysis staff need to know about the experience of dialysis patients during the COVID pandemic?
Well, I'm fortunate that I got a concerned nephrologist, and they've given us plenty of information, reading materials and everything, and so I think if everybody does their part, I think we'll all get through it.
Okay. Is there any other information that you would like to share with us about being a dialysis patient during the COVID era?
No, just still don't miss any treatments, and I can't count how many times a day I wash my hands and everything, and then I wash my apartment down with Clorox as far as doorknobs, light switches, or areas that I touch a lot. I just try to keep those disinfected.
Thank you so much, Mr. Henderson.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.